Hi, I'm Dr. Mike Datola, and I'd like to welcome you to this episode of Inside Dentistry's Product Talk. We are on location in Grand Rapids, Michigan at the office of Dr. Betsy Bakeman. Betsy is an accredited fellow in the AACD and is also an Inside Dentistry board member. And we're here today to speak with her about GC's G-aenial bulk injectable bulk fill composite. Betsy, thank you so much for spending a little time with us today.
Thank you, Mike.
You know, as an AACD member, I've always been a little intimidated by the accreditation process, and I'm just so impressed that you're an accredited fellow. So first of all, congratulations on that achievement. I guess this means that you care a little bit about aesthetics when it comes to dentistry.
Very much so, and so do our patients.
And so do your patients. Yes, I met one a little bit earlier, and she was showing off her dentistry to me, and I was really impressed with what you were able to do. It looked fantastic.
Thank you.
Both of us graduated back in the era when we were taught that to place a posterior composite, it just had to be in 2 millimeter increments, and you couldn't cure any deeper than that for light cured composite. And the G-aenial bulk injectable can cure 4 millimeters thick. Was it an adjustment for you to start to work with some of these bulk fill materials?
It wasn't really, because I've been using a bulk fill material, an auto cure material, for probably 20 years now.
Oh, okay.
And so I always was a little hesitant about depth of cure in doing increments, and so I use a bulk fill material. So to transition to this product was very easy for me. And there are a lot of similarities, because with the auto cure material of being able to flow, the G-aenial bulk has that same flow where you can just watch in the tip and see the flow down in the box. And it's really nice in that way. One
of the nice things about this material is that it doesn't require any kind of capping or veneering material. You can use it all the way up to the occlusal surface. But I know that you've got some aesthetically demanding patients here who probably are staring a little more closely at their posterior composites. And you shared with me that on some of those larger restorations, you like to use a capping material on top of that. Can you tell me a little bit about those two situations?
Yes, so the narrower restorations, to use the bulk fill from the depth of the restoration all the way up works really well, because you get the reflection of the enamel and it blends very nicely.
Right.
But on larger restorations, I like to layer that with a light cure material, the G-aenial Sculpt, and so to have a little more opacity to the restoration, but still a nice blend, and it seems to work better that way for me.
You showed me a case that you actually did this morning that I wanted to take a look at. We're looking at the before picture here. Can you tell me a little bit about what you were going to do for this patient?
The patient had distal decay on the first bite, second bite, and first molar. The second molar needs a full coverage restoration, so we weren't going to involve that today. She wasn't prepared to do that. So I wanted to go ahead and treat those interproximal areas of decay, remove the existing amalgam pit there on the buccal of the molar. And then I also, when I treat teeth, it's sort of in some ways extension for prevention. I like to treat those stained grooves, and so we removed the old restoration on the molar there, used microabrasion to clean the grooves, and then remove the decay on the distals of those teeth, and then went in and filled those. And I used the G-aenial bulk in the depth of the preparations, and then layered over with the G-aenial Sculpt, and then I used the G-aenial flowable bulk material as a sealant material in the grooves there, and that worked really well.
That's really nice. So it's kind of a combination of a class 1 or a class 2, and then also extends, like you said, for prevention by having a sealant. So it's almost a sealant attached to another restoration. And so when it sounds like when you're working on a tooth, you're working on a tooth. So even if you're just doing a DO, you're looking at the rest of the occlusal surface too.
Absolutely.
And how you might restore it.
And and how many products do you want to have out?
Exactly.
It was nice to just be able to use that flowable material. It flows really nicely. It has a really nice flow to it. So it's really nice for a sealant material as well.
You also mentioned that sometimes you'll use G-aenial bulk injectable for anterior restorations as well. I'm assuming that you're going to veneer it with the G-aenial Sculpt, but tell me how you use it in those situations.
When you want something to flow, I always worry about voids. I mean, voids are a concern, the area of recurrent decay.
Sure.
So when I can do the cervical aspects with a flowable material like that I can watch it flow, I can see it fill the area, I feel better about it, and then I'll a layer with the G-aenial sculpt.
That's a great idea. The G-aenial bulk injectable has the highest flexural strength in this category of bulk fill composites, about 173 megapascals of flexural strength. How important is it to you to have a strong composite for your direct posterior composites?
Absolutely, no question. You know, I mean, we look for strength, we look for lack of porosities. I mean, all those things are really important.
It's also very radiopaque. It's about 50% more opaque than enamel. Is it important to you when you're doing class 2s and then looking at those gingival margins to be able to have radiopacity to make sure that you're clean down there?
You know it is.
Yeah, it is. And there's nothing worse than a radiolucent material where you're looking down and you really can't see it.
Right.
One of the benefits of the G-aenial bulk injectable is that the nanoparticles have a full silane coating on them. Mm-hmm. And what this means is that you get that great adaptation into the cavity when you're putting it in there, like you said, without air bubbles or voids or things like that. It also it keeps it from plucking off the surface over time once the restoration's cured, and so it maintains its gloss for a long time. But it also relates to what you've said a couple of times, the flow and how easy it is to squeeze out of the syringe. You know, we think of a bulk fill, and the first time you pick up that syringe, you think you're really going to have to lean on it, but it comes out nice and smoothly. How does that help you to place it precisely when you're going into some of these cavity preparations?
It's almost counterintuitive. You know, I mean, with the strength, you think that you're going to have to really work to get it out of the syringe, but it does have really good flow, which I really like, surprisingly good.
Right.
And so you can just watch it, and the tip on the syringe is very, very nice. It's very narrow so that you can see past it and watch where you're placing it within the cavity preparation, which I also really like. I don't like a wide tip for something like this.
Right.
And so the narrow tip is really nice so you can see what you're doing.
It's a lot nicer than the old days of taking a bulk fill and just cramming it in.
And hoping for the best.
Hoping for the best and hoping that there's no air bubbles down there. It's nice to be able to see it flow in and know that it's adapting well to cavity walls. I like the simplicity of the fact that it's only available in 2 shades. A2 and A1, and I practiced for 15 years inside the country's largest dental laboratory, and those are pretty much the 2 universal shades for posterior teeth. Do you like not having to stock a bunch of different shades for a bulk fill composite like that?
Absolutely, because I mean, even though I have an aesthetic practice, it's the surface layer that matters,
right.
And so that's all we do. We keep it uniform, we keep it the same, so having an A1, A2, I mean, in general, I go for the A1
right.
all the time.
So you probably have 60 different shades of composite for anterior restorations, I'm guessing.
Right, where you may use, you know, several of those to do a single tooth.
Right.
Posterior, it's A1, and then we layer over the top, you know,
right.
If we're going to layer over the top.
Mm-hmm.
So, but A1, it's pretty universal.
Excellent. Well, thank you for spending some time with us today. I had a great time getting to know you and speak with you.
Thanks, Mike.
And that'll wrap it up for this edition of Inside Dentistry's Product Talk. So on behalf of myself, Dr. Bakeman, and all of us here at Inside Dentistry, I want to thank you for your time and your continued commitment to quality dentistry.